I will be discussing the science of breast implant illness and presenting data from our ASERF-sponsored systemic symptoms biospecimen analysis study, the first prospective blinded study with controls looking at women with self-described breast implant illness undergoing implant removal for their symptom improvement. We also looked at biospecimens, both peripheral blood and implant capsules, to see if there were any quantifiable differences between these patients and our two control groups.
I will talk about my two techniques of internal mastopexy in breast augmentation, especially about my new modify internal mastopexy technique, and I will explain you it step by step.
I'm presenting a masterclass on blepharoplasty where I will share with you tips, tricks, techniques and lessons learned over 28 years of experience. You will take home messages, important messages of how to optimize your results, avoid complications for the benefit, safety and satisfaction of your patients. Don't miss it.
Since 45 years I am dealing with rhinoplasties, and in the last years more and more patients are asking for a secondary or tertiary procedure. More and more patients need rib cartilage in secondary rhinoplasty for reconstruction and replacing the missing structures. I selected several patients to show you in videos our algorithm of dealing with this problem, and I hope to meet you in Istanbul.
My masterclass will be about the evolution of my body contouring practice, what worked and what didn't work.
Dennis Hurwitz from Pittsburgh to discuss combining limited thighplasty, limited brachioplasty with radiofrequency skin shrinkage. This is the future of plastic surgery, the sophisticated integration of limited operations with short scars and amplifying them with the application of skin shrinkage using external and internal radiofrequency.